Well, I spent my whole life dealing with innovative projects in large corporations, and the topic of health has appeared in my life through a personal experience as it happens many a time. I made a visit to a hospital, and this is how this started. We established a foundation, K.I.D.S, a foundation for innovators for children's hospitals, together with dozens of volunteers and my co-workers. We are trying to help in order for technologies, just as the one discussed before by Edita, would end up at hospitals and would help those who take care of our children, improving their working conditions and also making it possible to use such new technologies in an effective manner. We have magnificent doctors. However, hospitals are not as advanced in terms of technology as other sectors, such as banks and so on and so forth. So we are encouraging startups and corporations to support us and to implement such projects in children's hospitals. We started with the Centrum Zdrowia Dziecka, the Center for Children's Health. I was there with my son, and you can imagine that not much has changed since 1980s, at least not as much as we'd like to change. So our foundation started with simple undertakings, renovating the corridor with Patrycja Piekulowska as the president of our foundation. We also renovated the examination rooms in order to improve the working conditions and the conditions for the patients. We wanted to move on to other projects that can actually be then scaled up, used in the systems, starting step by step with smaller solutions that can then be promoted on a larger scale. Dozens of companies and corporations cooperate with us. They provide manpower, funds, and the solutions for our projects. Then we try to share our experience and our knowledge. During the times of the COVID pandemic, you'd be surprised not to see projects that do not deal with telemedicine or virtual reality. We look at patient experience and the work of medical professionals, trying to see which solutions introduced elsewhere in the world or by our startups could be used in children's hospitals. Our report, Children's Hospital of the Future, was one of the very first products of our foundation. We wanted to make our vision precise. We wanted to answer a question of what we would like to see as a children's hospital in the future. So after the first year of our operations, and we managed to implement projects with a total value of over 2 million zlotys. And I'd like to underline that all the work of the foundation is carried out by a group of volunteers. We actually do not employ any staff, so we do this in our spare time, trying to make this vision a reality. This report was prepared based on interviews and workshops with the employees of the Children's Hospital, parents, patients, and experts from Poland and abroad. We tried to build a vision of such a hospital for the future. We looked at the path of a young patient from the moment of arriving at the hospital, and we looked at the experience of both the patients, their parents, and the medical professionals. We identified 7 areas for transformation, and this is where we would like to help children's hospitals in Poland and also elsewhere in the future. So these 7 areas are then divided into subsections. Then we actually have 63 different units where we would like to support, and I'll discuss them later. So we can start with things that are most important for the patient or closest to the patient, because hospitals are there for the patients and the medical staff is there for the patients. So when you design digital services or modern products in best corporations, you use particular methods, and these are exactly the methods that we would like to apply in order to improve patient experience. It pertains to all the aspects, also not the non-medical ones, informing the patient about the visit, preparing the patient for the visit. Each of these experiences can be designed in such a way in order to limit stress and frustration to the lowest possible level and to limit fear. At each of these levels, we use the digital solutions together with our group of volunteers who prepare applications for the banking sector. So in the everyday work, we prepare an application for the parents. Parents can use this application in order to schedule, plan, and prepare for visits in the hospital. We also look at integrated care, and there we have 9 main subsections for integrating this care, engaging the patients, engaging the parents. We have an example from Colorado in the United States, and we'd like to promote it in Poland. That's engaging parents that already have experience of looking after a child with a particular ailment. We can use the experience of these parents to help other parents, to teach them how to look after their children. And then something that goes beyond the traditional brick-and-mortar hospitals. We had a webinar with Mercy Virtual Hospitals, and there are 300 staff with hospital with no beds. They have a telemedical center or telemedicine center that looks after hospitals, at hospitals, in hospitals wards, but also at home. This is something Edita has just discussed. So such solutions for people suffering from long-term illnesses or chronic illnesses can be applied. But we also need to look at the experience of employers and medical staff, because we can do nothing if we do not improve also in this respect, preventing burnout and other problems. So we want to improve the comfort and satisfaction level for the medical staff and non-medical staff of hospitals. Another areas where we want to support hospitals, we want hospitals to turn into innovation centers, not only curing their patients, but also trying to create new solutions, new spin-offs, new technologies. You may have a best doctor who is not an expert in technology. So this is where we'd like to support hospitals. They may have ideas, but they may also need experts that would help them turn these ideas into solutions. And nothing would happen without a healthy organization of these services. So management of the hospitals is very important. So here we can see the NASA headquarters, and the world's best hospitals also have such centers which actually manage the hospitals. Children's hospitals are the place where you can actually mobilize partners much more easily, because they are touched by children's health problems. So it is probably the easiest place to implement pilot solutions that can be promoted elsewhere. The foundation started in the Centrum Zdrowia Dziecka Children's Hospital, but we have invited other children's hospitals from all around Poland. We organize regular webinars where we train leaders from other hospitals, and based on our experience of parents and patients, we decided which are the most important issues. We are now moving to the third stage, where we actually offer grants and we fund projects and promote best projects proposed to us by different hospitals. So we are not only looking for partners who would fund our activities or support us with solutions, but we also invite doctors who have ideas to look at our foundation as a potential partner. We build a community, a K.I.D.S foundation community. We work with hospitals, doctors, parents, but also with young patients. We want their voice to be heard, and we want them to be involved in designing innovations. The foundation itself is also supported by our partners, by the media, by the funders, by the volunteers. We are a modern type of a foundation. We are not actually gathering funds as such. We are using smart funding in terms of time, expertise, and ideas that could help change our hospitals for the better. We managed to gather an exceptional group of experts from the healthcare sectors, but also from other sectors, and their experience is extremely valuable. We would also like to invite other experts. I'll be more than happy to answer questions. I would also like to invite you to visit our website, kids.org.pl. There you can find the information. There is also a printed version of our information leaflet. And I would like to encourage all of you to get involved, because we can all contribute, be it in a very small way, to the improvement of the healthcare system in Poland.